Hi guys, my name is Alexandra Żegalski and I am a physiotherapist. I'm getting a lot of questions daily from my patients about what kind of scanning test is the best. Is it X-ray best or MRI to find the origin of the pain? So that's why I decided to do this video and give you more idea about it. So stay with me and enjoy the video. Hi guys, and welcome back, and let's start with differentiation. X-ray and MRI. This is what we have it on the target today. And the first main difference here, X-ray gives radiations. It gives uses the radiation to see imaging. MRI not. MRI is a magnetic resonance imaging. So it uses really big magnets to see the imaging. So no radiations over here. X-ray, you can see only in 2D imaging. MRI, 3D. So as you can see, probably doctors or the technicians can see a little bit more on MRI than on X-ray. Imaging of X-ray, you can see bones very clearly. So the problems like fractures or dislocations, it's very good to use the X-ray in this case, because on the MRI, you can see mostly soft tissues as muscles or ligaments, spinal cord, or disc herniations. This is also something what we as physiotherapists looking for, disc herniations and which level it is exactly. Brain also, and other organs like a stomach or liver is also much better seen on MRI. You can also see some soft tissues on an X-ray, but it's not that really good to see. So probably doctors would prefer to use MRI to see a little bit more what is happening on the MRI. So what else? You can see some shadows, mostly on the bones, sometimes on the intestines or the lungs on the X-ray. Shadows, it means some tumors, some cancer problems. The same on MRI, then they can see like a mass, but always to confirm that we have something to do with the cancer or the tumor, they will use a biopsy then just to confirm. It's much more clear on MRI, but also they can see some shadows on the X-ray. Well, and the last difference over here, X-ray is much cheaper imaging. MRI is very expensive. So sometimes doctors prefer to use X-ray instead of MRI just because of that. They can also see a lot of things. The X-ray can say a lot of things to them. So this is also something what they have under consideration, the costs. As you can see, and probably if you had this case before, X-ray is less specific than MRI if we talk about the soft tissues. And for us as a physiotherapist, we prefer MRI because then we can see muscle problems if there are some damage in the muscle tissue. On X-ray, not that much. And a lot of pain is also coming from trauma, of course. Then the X-ray, then we can see if we have something to do with the fracture. But some pains, they are not really connected with any trauma. Sometimes pain comes just out of the blue. And then it's much easier to see if we have something to do with the muscle or the ligaments. Then the MRI is much better test in this case. But I want to talk a little bit more about why the doctors prescribe more X-ray or sometimes ultrasound, not MRI, and they just take this precaution over here. So stay with me for the next part and I will talk a little bit more about it. Hi guys, and welcome back. Now you know a little bit more about the differences between the MRI and the X-ray. Now there is a time to answer your question about why the doctors prescribe X-ray or USG instead of MRI. Well, as you already know, the MRI is very expensive testing. The X-ray is less expensive, so that's the first reason why. Another one, because the MRI is very good to show the tumors or the masses in the body, so they prefer to save it for people who are more in need of this imaging. So just to avoid the queues and not do it, not necessarily for the normal pain like a lower back or the neck pain. So they are trying to save a little bit of space for people who are a little bit more in need, and they need it very soon, very quickly, this MRI scanning. So those two things, that's what they are thinking about, and they are keeping in mind. Another one is anamnesis. Anamnesis is like an interview with the patient. Doctors do it, the physiotherapists, they are also doing it, and it's designed to hear and have the idea of what is going on. There are some specific keywords what we can hear while asking those questions, like trauma, for example. This is one of the questions what you can get from the physio or from the doctor. If you have a trauma, like you fell on your hand, or you've been playing football with your colleagues and you've been pushed from behind, it can be indication of fracture or for dislocation. So probably you will get the X-ray just to confirm it and to see where it is. And actually X-ray in this situation is much better because it shows bones much better than the MRI. So the trauma is the first one. Pain at night, it can be indication of the inflammation. So for example, if you sprain your ankle, then is also, of course, hurting a lot from the very beginning, but then maybe you are walking a little bit, it's a little bit better, but then at night or before you're going to sleep or while you're sleeping, the pain is waking you up, then is the indication of the inflammation. Probably it's better to go to the doctor and check it just to be sure if there is not more than just a sprained ankle. Again, you can get like a fracture of the bones or some problems with the ligaments around the ankle, which are holding the ankle on a place. Then probably you will get the X-ray. If not the X-ray, you will get the ultrasound. Ultrasound is very good to show the damages of the tendons as well, or the ligaments, on a very shallow place. So just below the skin, you can see it very well by doing the USG. It also shows the inflammation. So probably you will also get it before getting the MRI. Then you can get a question about the type of pain. And you can have like a knife needle-like pain, especially when you are doing the specific exercise, and then you can recognize the pain right away. So then it's the indication of the muscle troubles. Knife and needle like pain is more like a muscle problem. Then again, you can get the burning sensation. For example, you've been lifting something from the floor and then it started to hurt. It can be indication of the herniation disc, but not always. It also can be just like an inflammation, local inflammation of the spine. And then you can is simply the inflammation. Inflammation is also taking up to 5-7 days approximately to heal by itself. It's just like normal flu. If you are getting sick and you have the fever and all those symptoms, it's taking around the 7 days to heal up, and the same is happening over here. So if you are going to the doctor and they can hear that, okay, there is only burning sensation, probably is not that severe, so probably you will get the prescription or referral just to go home and rest and see what happens after some time. Most of the times it's getting better by itself, so that's why here they are keeping it slow. The last type of pain is the radiation pain. Here you are probably getting the most annoyed about why the doctors don't prescribe the MRI, because you are connected the radiation with the herniation disc. Most of the time it's true, but most of the cases, even though it's a herniated disc, you can easily train it, and then it's getting better after some period of time, maybe a little bit longer than just the inflammation, because still it needs a little bit more time. There are more structures which requires healing, but not always. It's not always connected with the herniation disc. You can also have problem with the entrapment places, like with the sciatic nerve, which is going through the buttock, and there is one muscle called muscle piriformis, which if it's getting tensed, then it's pushing on the sciatic nerve, and then you can get also the radiation pain. So it's not always connected with the herniated disc. It can be, but not always. There are some specific tests to exclude or confirm some diagnosis, like a straight raise test, and this is where the doctor or the physiotherapist is taking your leg up while you are lying on your back, and then if the pain comes below 45 degrees, then the test is positive, then probably we are dealing with the herniation disc. Then you probably will get the referral to MRI just to confirm it, which level it is and how severe it is. If you need the operation, or you can still go to the physiotherapist and you can avoid the operation. Remember, doctors prefer avoid operation if you can train it over some time, and it will get better. So now, lucky you don't need the operation. But sometimes, of course, there are some more severe cases where you really need to go for the operation to get rid of the pain and the symptoms. But not always, as you know, for now. If you want to know a little bit more about the herniation disc and how it's developing and what you can do, what is better to do, how it's working, you can read a little bit more about it on our website on OsteoMedica.tk, or you can keep observing our profile on Instagram and Facebook, also on YouTube, and then you can follow up if it's interesting for you to know a little bit more what is happening with your body. Then you can do it and observe us and get to know things a little bit better. So you can read it, you can follow us. For now, thank you for watching.